Buenos días. Welcome, everybody. Gracias por estar aquí. This is our Tuesday weekly update on coronavirus. We bring you the state of art from health to economy, business practices, and policy to make sure that we, the Hispanic leaders in this country, are informed so that we can take better decisions about what to do. It's very important that we also inform our constituency. 44% of Hispanics in America are on denial on COVID, and we are disproportionately affected, not only at the health level with the highest over-indexing in our mortality rates, but incredibly impacted at the economic level. Our small businesses, our entrepreneurs, and our independent workers have been hit the hardest. We work in those industries that have been shut down completely, the service industry. So we have lost our contracts, our incomes, our salaries, and we put together this plan, the Hispanic Response and Recovery Plan, to make sure that we can mitigate the impact that COVID has in ours economically with us, but also be able to put a plan together so that we can do a recovery phase and get back in our feet faster. Today, as every Tuesday, I'm delighted to welcome Dr. David Nabarro from the World Health Organization. He's a special envoy for COVID-19, and he's delivering a message for all of us today. David.
Once again, I'd like to say hello to all of you that I'm connecting with through the Hispanic Star. I really enjoy these moments to be alongside you, and also I really like preparing my notes for each session. You know, I'm looking at what's happening around the world, and I'm seeing how the virus is spreading so powerfully into communities that are not well prepared to deal with this kind of challenge. So in Latin America, we're seeing serious problems in Ecuador and Peru and parts of Brazil, even parts of Argentina. They're mostly places where people are gathered closely together, but there are also some parts of the countries where there are indigenous people as well. They're being hard hit. And then they're looking to other parts of the world again and seeing how in crowded settlements people are facing real challenges. And then as I move into Europe, to Spain, I'm seeing the country beginning to look at ways of easing some of the lockdown restrictions that have been imposed to try to get on top of the COVID outbreaks. And then in the US, it's a very mixed picture with the outbreak beginning to subside in New York. In fact, there's good signs that things are leveling off, but in other parts of the country, still climbing numbers and challenges. And this is, I think, what we're all going to have to get used to, that not everywhere is at the same stage, and that there are indeed quite big challenges for shifting from lockdown, what I call being COVID ready. So what does that mean? First of all, we have to admit to ourselves this virus is just not going to go away. We've all got to learn to live with it as a constant threat. We must remember that the outbreaks start really small, but very quickly they build up and become large. And so within a couple of weeks, an outbreak can increase 1,000 times and many more times if you just don't react to them quickly. So when the outbreaks are building up, that's when you've got to act early, prevent infection. Of course, trying to make sure that you limit the number of people who are affected with physical distancing, hygiene, and wearing face coverings. And then being able to find people with the disease quickly in our own localities, and making sure that people who've got the disease are out of the way, separated from others, looked after, of course, but kept separate. And those who they've been in contact with recently, they're also kept separate. In that way, although it feels a bit over the top, what you're actually doing is stopping the disease from spreading. All the time we want to protect the people who are most at risk. And there I've said before, but I want to say it again and again, it's older people, particularly older people in residential accommodation, in special nursing homes and the like. They need really, really to be looked after. They can be at such risk. And there, those of you who care for older people have such an important role. And thank you for all the care you're putting in to those you look after. We're focusing on the people most at risk all the time. But let me come to one specific aspect of this. we're finding that people, when they're affected by COVID or when they're threatened by the risk of COVID, and especially when they're asked to stay at home, they can develop challenges with their mental well-being. And we find that mental ill health is something that's building up. So we're looking for ways to support people. What I always say is, just because we have to be isolated in order to protect ourselves, that doesn't mean social isolation. It really we must avoid that. So I'm saying physical distancing with social inclusion in order to protect mental health and well-being of all the family, young children, adolescents, adults, older people, everybody. We've got to look after mental wellness and make sure that people are not stressed. And sometimes there's a lot of stress that builds up and it leads to people really falling out with each other. And we all know that that can lead to really horrible disputes. And so we must be very careful in those situations to protect people who might be subject to disputes, particularly when they're at home. So mental health, well-being, looking after all parts of society, so important as we deal with COVID. We're learning as we go. I've told you before that this is a new virus and we're just going to understand about it. So that's why I like talking to you. I like sharing with you what I'm picking up from around the world. But I hope you'll share with me if you find things. You'll contact the Hispanic Star and tell me whether you've got big questions. I'd like to help you always make sense of what is happening. I'd like to help you think through what COVID is going to mean for your future. I'd be very interested to connect with you if you are feeling that COVID is going to make your own jobs be insecure and all that sort of stuff. So please don't hesitate to be in touch, because this is a global challenge. It's affecting all the world's population. But what really matters is how we deal with that challenge when we're local, how we deal with it in our businesses, how we deal with it in schools, how we deal with it in the hospitals, how we deal with it in labour unions, how we deal with it in justice, how we deal with it in the armed forces, how we deal with it everywhere. Let's keep talking about COVID. Let's keep working through the Hispanic Star. And thanks so much again for the chance to be in touch with you today. Bye-bye and good luck.
Thank you, Dr. David Nabarro, for this video. We hope that we have him every week live, and then there's an emergency that happens dealing with COVID. But I am delighted actually to welcome the incredible panel that we have today, talking about like economy, policy, business practices, corporate best practices, as well as the state of the small businesses through Ramiro Cavezos, the president of the Hispanic Chamber of Commerce. We've been talking since the beginning that the Hispanic community is disproportionately affected by COVID and disproportionately exposed, since we have so many people on the front lines. And today we're disproportionately represented by men in this panel, because all the women that normally are here are working. So I'm going to welcome the second panelist that we have today, a new person for our panels, Andrew Edgecliffe-Johnson, who's the US business editor of the Financial Times. Andrew, welcome. I want to ask you a little bit. We've been every week talking about the economy, the state of the global economy, whether it's a V, whether it's a U, whether it's an L, whether it's a W, whether it's a heartbeat. What is the state of the global economy? But also, Andrew, if you don't mind, just like deep dive a little bit on the US. What's the panorama of the US? When are businesses gonna start opening up? What's the tension that you see between, like big corporations, small corporations, and overall, in a way, what do you think the impact of the pandemic is in certain industries, and whether that has changed over time? What's the outcome this week? Welcome, Andrew.
Great. Well, thank you for having me, Claudia. And yes, I am standing in for Gillian Tett, who sent her regrets today. She's involved in a big FT virtual conference we're doing this week and can't make it, unfortunately. But let me try and try and answer those many questions. I think we are entering a new phase here on the economic picture and the kind of question what businesses' place is in the economic recovery. Let's start with the obvious big headline. We are dealing with historic levels of unemployment. Very, very suddenly, large and small companies alike are having to confront their payrolls, their headcount. Many of them, interestingly, try to hold off cutting jobs for as long as they possibly could. This was not a sort of knee-jerk, let's protect the shareholders at all costs, let's slash the headcount whenever things get tough. But now they're really sort of staring at this longer, deeper, more unpredictable crisis. They don't know whether it's going to be a V-shape, a U-shape, a heartbeat, as you put it. You know, I think there's a general consensus forming that if we're lucky, it'll be a slow recovery. If we're unlucky, there'll be a series of setbacks in that recovery. So business, one thing to remember is even with these hideous headline figures on unemployment, many businesses are telling us they haven't actually finished the layoffs they're going to have to do. You know, they held on for a while. I think we will get more bad news, unfortunately, on this front. And government relief programs such as the PPP have obviously been designed to try to persuade and incentivize companies to keep people on staff, but they are temporary in nature. And they're loans which have to be repaid. And businesses are starting to think, suddenly focus on the prospect they're going to have to pay this money back in June or July. And that's starting to weigh on sentiment as well. But if you pull back a little bit and look at the context, from the business point of view, corporate America went into this with record profits, but also with record debt levels. And the latter haven't been a pressing problem because of the former. But we are now seeing this kind of division between the over-leveraged parts of corporate America and the bits with more sustainable, solid balance sheets. And I think one of the interesting splits we're seeing between the winners and losers is simply around those balance sheets. It's about the kind of position they went into. And I think for the longer term, we're now seeing investors pay much more attention to companies' financial sustainability. Companies have talked a lot about sustainability. It sounded rather kind of vague and airy, but suddenly it has this kind of balance sheet element to that discussion now. The more resilient businesses, the ones that are not kind of running to the government for bailouts, are moving into a new phase, though. They're starting to think about the immediate challenge of reopening, and they're realizing that most of the judgments on how to do this are going to be on their shoulders. They're not going to get a playbook handed down from the federal government, from state governments. And I think particularly in the US, there is a lot of confusion about quite how to do this, and there's a sense that it's going to be on businesses. They're worried about potential legal risks if they get it wrong, if people get infected, if they have outbreaks in their plants and their offices. But they're also starting to plan for what the medium term is going to look like, and they're making slightly longer term arrangements for the staffing, the products, the services they're going to need beyond the next couple of months. So there is a bit of a kind of a sense that people can start to think about the future. Fourth point, I'm very closely involved in our Moral Money platform, which is our ESG investing, and sort of we cover all the people who are trying to create a more sustainable, inclusive, stakeholder-focused capitalism. But even though I've been steeped in that for the last couple of years, I've been really struck by the divide that's opened up in the crisis between the companies that are seen to have treated their people well and the companies that have not. Think of cash-rich Disney announcing thousands of layoffs before deciding to hold off on its dividend payments. That went over really, really badly. So there's a moment of reckoning for the stakeholder capitalism movement that was personified by the Business Roundtable statement last year. What's been really encouraging is that companies who score strongly on these ESG, environmental, social governance issues, have actually outperformed in this crisis. And there's been a whole new focus on the kind of the social issues in ESG as well. So I think there is some source of optimism there. And finally, I just thought I'd leave you with a thought for the new phase we're entering. I think every business is having to start to ask itself, what does the economy look like when 1 in 5 Americans potentially is unemployed? And what is your plan as a business for catering to those people? There is a danger that a lot of companies that grew rich serving the middle class are going to suddenly struggle in this period. But I also think there'll be a lot of smart companies who find ways to prosper if they can start to offer maybe stripped down, more basic, more affordable versions of their products and services to capture this market of people that suddenly has less disposable income than it used to.
Thank you, Andrew. If I may, just like a quick follow-up question, because I think that it's really related to what our next guest, David Gonzales, will be talking about, which is, so you mentioned that companies that are ESG, environmental sustainability and governance issues are outperforming the others. Is that all across industries, regardless whether you're, whether you're in those industries? Are you saying that people that care about their employees, their consumers, and their communities now have an easier time in the future, regardless of where their industry, where they are?
Yes, and now obviously these numbers can be a little bit distorted by the fact that ESG funds don't invest in shale oil companies, for example, and the shale, the oil sector, the energy sector has been particularly hard hit. But even when you strip that out, there is quite clear evidence now that these more sustainably managed companies, which have been thinking more about the long term, thinking about that more holistic group of shareholders, employees, suppliers, customers, not just their shareholders, but their stakeholders, have been outperforming. That is running across all industries. We can survey after survey that's showing this holding up. And we've been seeing this evidence coming through for a couple of years now. And I think a few years ago, people felt there was a trade-off. If you were going to be something nice for the environment, or if you're suppliers, your customers, it would come at a cost. Your shareholders would have to take some sort of pain. And I think we've had people like Paul Polman of Unilever saying now for a good couple of years, actually the trade-off is disappearing. Increasingly the rewards are for the companies that are acting more sustainably.
And I do want to say, we all understand that this is a hard hit. It's 30% of the economy, going down. The bite is $6 trillion just for America. And nevertheless, the Hispanic community, 60 million people, 18% of the population, 12% of the GDP, mostly affected. Ramiro Cavezos, the president of the U.S. Chamber of Commerce, will talk about how, 1 in every 4 of our small businesses are at the brink of closing, and half of them have been temporarily closed. And yet, we're the growth, we're the future, 4 decades of growth, unemployment as, as future employees and consumers with a big, big loyalty to be win out there. And that's why I'm delighted to welcome David Gonzales. David Gonzales is the Chief Diversity and Inclusion Officer of BMS, of Bristol Myers Squibb. And I would love to hear actually what you're doing. Share a little bit of the corporate response that you have from this huge company where you work, and what's the response to COVID, and what's the response and the actions that you have taken for the Hispanic community in particular, if you don't mind, David.
All right, excellent. Well, thank you for that. And Claudia, first, I want to thank you and also all of the great panelists here. It's such a privilege and an honor to be with you all today. And I was intrigued by a lot of the comments here. As Claudia has said, I'm the Global Chief Diversity Officer for Bristol Myers Squibb. And Andrew, I was listening very intently to your comments because I wanted to just begin to talk a little bit about commitment. And I think that's incredibly important for an organization such as ourselves. And the commitment that we have not only to our employees, but also to our patients and to our suppliers. And I know, Ramiro, that will ring well with you, but also to the broader community, particularly during this COVID crisis. I just want to start by saying that we operate under this incredible strategic intent around making sure that we are delivering and that we're developing and that we're delivering innovative medicines to help all of our patients prevail over serious diseases. And I've got to tell you, this commitment that we have has been absolutely unwavering during COVID. And I just want to talk a little bit about at the corporate level what that means, but then also talk to you about the commitment that OLA, our Organization for Latino Advancement, has made during this time of crisis, particularly, Claudia, as you've said, the disproportionate impact that it has on the Latino Hispanic community. But let me tell you what we're focused on during and working through COVID right now. First and foremost, we are absolutely focused on protecting our workforce health and safety. There could be nothing more important than making sure that all of our workforce and all of our individuals who help us deliver our innovative medicines are actually protected, as I mentioned, both from a health and safety perspective. We also, and I'll dive down a little bit deeper around the commitment, we're also supporting our patients because we know we want to make sure that our patients who are suffering from serious illnesses are supported during this time of crisis. And we'll talk about the Bristol Myers Foundation and our patient assistance programs as well. And then I also want to talk about how we're providing relief efforts around the globe as well. But more importantly, how we have mobilized and energized our workforce, and specifically our Latino, Hispanic workforce, to make sure that we are committed to the engagement in our communities where we live, work, and play. But I think it's important to recognize, and as we talk about our commitment around ensuring workforce safety, we're a scientific company. We are a medically driven organization that really relies on science to guide everything that we do. And so we are absolutely focused on making sure that through the science, it guides every single decision that we make. And that includes about how are we using science to provide insights into how you work from home. And what that means is making sure we have these vital connections to the CDC, to the World Health Organization. I was excited to hear David speak about his commitment through the WHO and making sure that all of our employees have access to that information. Secondly, making sure that our patients are supported. And I want to point out, and I've just taken a few notes here that I think is really important to bring to this audience, and that is that we are making sure that our patients who need our medicines have access to the medicines. And in fact, I just want to point out that over in the year 2019, through our patients assistance programs and the Bristol-Myers Squibb Foundation, we have committed more than $2 billion in free medicines to patients who perhaps didn't have access or couldn't have afforded their medicines. And oh, by the way, on April the 7th, we expanded this patient support program to make sure that people who were perhaps unemployed and who couldn't afford their medicines and have lost their health insurance, that they had access to all of these medicines. I've got to tell you, damas y caballeros, if that isn't commitment, I don't know what is, and I'm so proud of the work that we're doing to help our communities at large here. It is unbelievable. But it doesn't stop there. I want to talk a little bit before I talk about OLA and the great work that we're doing there around the work that we're doing with the Bristol-Myers Foundation. In fact, we've committed over $14 million to make sure that we are serving and funding health service organizations around the world and also patient support groups, specifically focused on cancer as an example, to make sure that they have the aid and education and access to materials in a very complex world to ensure that they're always safe and that they have access to the latest information. And also what I'm very proud of is, by the way, you know, we're a medical organization. We have doctors, we have healthcare providers, we've got people that are very interested in serving our patients. Guess what? We are supporting them as they volunteer in local hospitals, and we are making sure that they receive their full pay and full benefits during this crisis situation, so that they're actually in the community serving at large here. And I know many of these people, and in fact, Dr. Fetty, who is affectionately known as Letitia, she's actually a practicing physician and heads up our OLA group. She has talked about her views around volunteerism and epidemiology and has guided OLA to really do some great work that I'll talk about here in just a few minutes. And I'm going to cheat a little bit here because I want to point out some things that I think are really important for those of you on the phone. We have done something really transformational in the engagement of our employees. I know many organizations have what are known as employee resource groups. We actually have converted and transformed this into a business model where we have 8 what we call people and business resource groups. Now, what's different about that? They actually each have a full-time high potential leader in that role who does nothing but lead that organization against a 3-year business plan and reports out on their progress every quarter. Now, why is that important? Because during COVID, these people in business resource groups, I might add, there's 11,000 people that are members of these groups. That's a third of our workforce in over 46 countries around the world. We have mobilized them to help our COVID activities, and specifically focused in on education and awareness around sources of information. Secondly, and I loved, and my apologies, I think it was the great doctor who mentioned about well-being and about health. We focused their efforts around how do you ensure the health and well-being of all of our employees around the world. 11,000 members focused on this. And then lastly, doing something really incredibly exciting called Skills to Give, which is virtual volunteering in the communities. So that's what our 8 people in business resource groups do, but one of them is OLA. And the leader of that organization is Dr. Fetty. As I mentioned, she's affectionately known as Leticia. And they have done some incredible work and engagement of the Latino Hispanic community. Oh. First and foremost, they've made sure that every single member is aware of the CDC and WHO information, both in English and Spanish, I might add, in order to be able to educate our workforce, but then also move that information back into the community, which I think is really, really important here. And they hold weekly meetings among all of their members to make sure they've got the latest, most relevant information for the Latino community, to make sure that they're educated and understand what resources are available to them. I think that's really incredible. Also, I might add that one of our members was inspired in Puerto Rico and composed an original song in Spanish to help motivate the community around hope. And we're just very excited about the fact that they did this, and they did this on their own, and it's now almost gone viral, I think, within the company, which we're very excited about as well. Secondly, yeah, it's really exciting. And then secondly, let me just say that we are really involved in our strategic partners, Claudia, members of your Hispanic promise group, such as Unidos, the Congressional Hispanic Caucus. We are working with them on a weekly basis to make sure that we're connected and really getting our messages out into the community. And then lastly, we've got a lot of work that we're doing on the volunteer aspect, Skills to Give, in which Unidos is a member of that. And we actually volunteer and give of our time and our talent in order to be able to help lift up the whole organization.
And I think that—
So I throw a lot of information out at you, but it's you can tell I'm passionate. I'm very excited about this work, and I just really appreciate the time on the panel. It's been really tremendous. Thank you, Claudia.
Thank you so much. It's very relevant. I mean, like, just on the data, 20% of Hispanics under 65 years old are not under any medical insurance or any medical plan. And for more than two-thirds of Hispanics, COVID is a major health threat. So having a commitment of an organization like yours matters. And also it matters when we're speaking, and I want Andrew actually to hear this, but we got data that indicates that 117 brands all across America since COVID exploded, have started talking and changing their communications to COVID, to message on COVID. But only 13 of those are targeting Hispanics or targeting language. And that's why we have an incredible disproportionate number of Hispanics that are not, like, aware fully about COVID or are on denial. And it's very important to have your commitment. We thank you for being here today. And we also want to invite you, David. We have, as Hispanic Star, the agglomeration of all these Hispanic organizations and corporations that are friends. We want to activate people. We want to move that commitment to action. So we invite you to join us on that day of action, May 21, where we have already a number of companies. We have 10 locations all across the country in which people are going to be doing. Either you donate, or you volunteer, or you share. And that's an opportunity for corporate America to show leg about your Hispanic friendliness. So welcome, and really thank you for being with us today. David Gonzales, Global Chief Diversity and Inclusion Officer of BMS. I would like to welcome Mark Williams now to give us an update, as every week, about what are the updates in Washington. What's the policy update? What should we be aware of? What's good? What's bad? What should we be lobbying for?
Claudia, thank you again for having me on the panel. I really appreciate it, and thank you to the other guests on the panel. Last week I was telling you Washington was in a little bit of a wait and see mode. The Senate was in session, not doing a whole lot. The House was not. Look for that to change this week. We'll see text for the House Democrats' Phase 4 COVID relief bill today. Steny Hoyer announced that just a little bit ago. Look for some things to be included in that bill, to be a second round of direct payments, $1 trillion for state and local aid, an extension of unemployment benefits, potentially a 15% increase to maximum SNAP benefits, some rent and mortgage relief, and a relaxation of loan forgiveness elements to some of the Main Street lending programs for mid-sized nonprofits. Now, House Dem leadership did tell their conference this week that they could potentially vote on this bill on Friday, or it could slip to Tuesday next week. So we'll see legislative text today, a vote potentially later this week or early next week. But again, it's important to remember that this legislation has not been negotiated with House Republicans, the administration, or Senate Republicans. So what we could see is a protracted negotiation on what the next steps of federal COVID relief are actually going to be. We could see these negotiations go into, potentially early June, but we'll see a vote later this week, early next week, and then negotiations for probably about a month. On the Senate side, the senators are taking a very much wait and see approach. They've spent $3 trillion on the CARES Act. They want to see how that's being implemented and how that's being spent. There was some apprehension that PPP would run out of money again. I think that Senate Republicans have eased those fears a little bit. They don't think the PPP is going to run out of money as quickly as they thought it was going to. A couple of things that the president has put out there that he'd like to see in the next package. You haven't necessarily seen Senator McConnell come on board with, at least publicly. Among those things are the payroll tax credit and a capital gains cut. I think one thing to really look for, and we talked about this last week, that's going to be a centerpiece of Republicans and their negotiations with Democrats, is going to be liability protection. It's a huge Republican focal point. And the Senate Judiciary Committee is set to hold some hearings on that today. On the administrative, one last thing to keep focused on is, and I just had a call with several House Republicans prior to this call. They are laser focused on Chinese supply chain issues. Look for that to be liability protection, Chinese supply chain to be the two big kind of markers that Republicans put out there, especially as it pertains to the pharmaceutical industry. Now, I don't know if that gets handled in a phase 4 bill, but that's definitely going to be out there and at the forefront. On the administration side of things, the president announced on Monday $11 billion to ensure that states, territories, and tribes have the resources to meet their testing goals. They say by the end of the week, more than 300 retail testing sites will be operational. So that's obviously a big deal. Also, FEMA is sending supplemental shipments of PPE to all 15,400 Medicaid and Medicare certified nursing homes. So they'll be getting additional PPP on those fronts. And then late last week, USDA approved $1.2 billion in contracts to support American producers and farmers through what they call the USDA Farmers to Families Food Box Program. And so through this program, USDA partners with local suppliers to purchase and distribute up to $3 billion in fresh produce, dairy, and meat products. So that's the update from DC. Obviously, lots of things are fluid, but I think the key takeaway is that there's going to be more movement on the legislative front starting today. So
anything that we should be worried about, that we should all take action on together.
I think on the small business front, it's key to keep an eye on the PPP program and the parameters that SBA and Treasury are moving around there, and if the fund actually stays viable and if enough money stays in there. I think as we talk about the effects on small businesses, we want them to be able to access that money. So that's a key thing to look at. Also, I think a key flashpoint is going to be on the liability protections, especially in the meat packer producing world, right? Because as you see the president has said, we want to keep these, the meat packer plants open, yet the workers there are contracting COVID at a very high rate. Yeah, so how do we even that out? How do we keep our workers absolutely safe? But at the same time, how do we keep food on the shelves of Americans? I think that's going to be a big flashpoint. And how we figure that out, I think is still to be determined.
Yeah, Mark Williams, a principal of Ferox Strategies. I know that on your website, you have a number of resources that we extract actually and bring to the Hispanic Star directory of resources, but for all of you, they have them in language, they have it in 2 languages, all the resources and news. And that brings me actually to a great transition. Ramiro Cavezos, our dear friend, one of the pillars of the Hispanic Star Alliance, who's the president of the Hispanic Chamber of Commerce. It is quite clear to me, Ramiro, that what you're representing is literally, like small businesses in America are 50% of all the jobs that we have. Hispanic small businesses on their own are $700 billion in sales, like 10% of the GDP. If you agglomerate that, what's the update? What's happening this week for small businesses? Any news from the Hispanic Chamber of Commerce?
Well, Claudia, thank you for bringing us all together and for the Hispanic Star Campaign. We'll be with you on May 21st as a strong ambassador and partner. And I want to thank the fellow panel members for the great information they've shared. You're correct. More than 10% of the GDP of our country was derived prior to the COVID crisis from Latinos. And these 60 million Latinos generate $2.3 trillion prior to March. I can say that at this time, it's very clear that small business and Latino business is big business for the future of this country. So at the United States Hispanic Chamber of Commerce, our network of 250 chambers, and many of our Hispanic business owners, many of them who are on this call, they represent the present and the future economy of this country. The economic engine has been stalled. 1 out of every 4 businesses have been closed or temporarily closed, as you said. Our focus, and I'll be very specific, Claudia, has been to advocate and legislate with both parties. We are a bipartisan organization based in Washington, and it's very clear that we may be at the table, but the table has been steered away from us for many, many years. It is our job to make sure that through the Paycheck Protection Program and the CARES Act, that we seek the following. We did send a letter last Friday to Secretary Mnuchin and Administrator Carranza, and of course, many of the other top legislators, that we need to make sure that Hispanic business enterprises are integrated into the supply chain for the US government. The largest buying service in the world is the US Department of Defense. And it's very clear that less than 7% of their purchases going to small minority and women-owned businesses is not a sustainable economic model, nor fair to taxpayers. We have also asked that we extend the Paycheck Protection Program to 2.5 months. It is not sufficient for many of our businesses, the coverage that has been provided, and that we also seek the dollars that have been paid back by the large companies during the first round that should not have applied but qualified, that money that is returned back to the government, that it also is made available to our Hispanic business enterprises that were shut out of the first round. We're happy to hear that the second round improvement has been made, but we are still way behind in getting our fair share. I will also say that we sent a letter that last Friday that we continue to expand opportunities, not just to lenders, but to non-lenders to get into the business of providing capital. Our environment will change forever. Banks will not be seen as the only capital providers in the future. It will be anyone that has access to capital. And we believe that's a good thing, including credit unions, including companies like Square and PayPal. And so our opinion is that the more capital we can put into small business, the more the Hispanic business enterprises that will be able to save. And I'll just conclude by saying that we need more transparency in lending. When someone goes in to apply for an SBA loan, they're not asked if they're Hispanic or African American or what their ethnic background is. So there's no way of tracking where these dollars are going. All we know is the size of the lending and the state in which that loan is made. So we also want to have the forgiveness of payroll taxes for all small businesses, not just Latino-owned businesses. 30 million small businesses in America drive our economy, and we need to get them back into the game. And payroll tax forgiveness and a credit is really important. The last 2 points that I want to make is that any undocumented businesses or employees that we can confirm have paid into the Internal Revenue Service should be allowed to have access also to the CARES Act. It is unfair for someone to pay their fair share of taxes and yet cannot benefit through this program. We have 330 million plus Americans, and of course, 60 million of those are considered Latinos. I wanted to share with you that the opportunity for moving manufacturing to this continent is alive and well. We must pull out as much as we can our manufacturing from other countries, especially China, and help our supply chain by using the USMCA that was just approved in January, February, to put our businesses in Canada and Mexico, which will actually strengthen our trading bloc around the world. So with that, I just want to say, Claudia, thank you for your leadership. We know that this is not easy to do, but at the U.S. Hispanic Chamber of Commerce, we're going to continue to advocate for our small businesses. We know, as each of you do, that we see the best in people and the worst in people during a crisis. And for us, talk is cheap, actions speak louder during this time. And this is a global recession that we're seeing that we need to move forward. Recessions typically last 18 to 24 months. This one will last a while, and we're going to have to dial back into the economy, not flip a switch, as we all know. So thank you, Claudia, for your leadership.
No, and not only that, but we have to, the reason why we're doing this is to unite the way that we discovered through these webinars that PPE, the distribution of PPE through those organizations like Feeding America, we're largely going to the African American community and we're not reaching Hispanics. And this is where we all said, like, what a second. So let's actually all advocate for PPE to be distributed, reaching Hispanic communities, not only people of color. We are distinctive and we live in distinctive communities. And if we know that PPP has to be advocated and we have to raise our voice together, this is the time for you to call on your community to say, this is where you need to support. And I know, Ramiro, that we're sending today, as we speak, a letter to Corporate America, co-signed by you and 75 Hispanic leaders saying, Corporate America, this is the time for you to stand up, to step up for Hispanics. This is where, this is the right thing to do, the smart thing to do. Demand will come back, and if supply is not there, we're going to have a deeper economic problem. So let's work together and be on the same table. These are the 5 things you can do with us. So Ramiro, this is the for you to actually tell us what to do. I want to thank every one of you for being here today. We have a closing video from Jesus Mantas, who's the managing partner of IBM, telling us a little bit about what IBM is doing and some corporate practices, but I want to finish here, let the video roll by thanking everybody. We do this every Tuesday, 45 minutes of information for all of us to be aware what we need to advocate for, what we need to be aware of so that we can take better decisions, because Hispanics United are stronger and we need a plan so that we can get moving. Thank you so much, everybody, for being here. Let's go with Jesus Mantas from IBM.
I'm sorry I couldn't join you live, as I have done in the past, but at least I wanted to join you by means of this video virtually and share some of the things that we did last week that may be of interest. Last week, the IBM Institute of Business Value completed a study of how behavior is changing in the United States as a result of COVID-19. This study covered 25,000 individuals that were interviewed. Revealed a set of changes that people are going to have to adjust. I myself actually did a radio tour on Friday to 17 Spanish radio stations to make sure that we're conveying all of this information to all of the Hispanics in the US. Let me read to you some of the most remarkable findings. For example, the study found out that half of the people that used to use Uber and Lyft ride-sharing applications before COVID-19, after COVID-19, they're saying that they will not use those ride-sharing applications anymore. Big impact if you're an Uber driver, or big impact for all that infrastructure. Many of those people that we interviewed said of the people that use public transport, 1 in 5 will no longer use public transport, and 17% said that they will use their own public vehicle more than they did before COVID-19. In terms of events, the study is very clear. 75% of the people said they will not attend any big, concentration event for the rest of the year. And that includes, big events, but also includes over 40% of the people said they would not go to a theater or to a movie theater, movie theater. Some of the other findings, for example, interesting how the psychology is changing. We are all learning not to touch our face, not to touch things. That psychology is impacting everything else that we do. For example, the study said that 40% of the people are looking to adopt contactless payment methods, as if the not touching things is expanding to any other things that you can do, including paying. So what do you do with all of this? How do you adjust? Well, first, the adjustment and the impact is different in different industries. For instance, in the health industry, one of the findings of the study is that about 31% of the people, 1 in 3, actually tried telemedicine in this period of time. They hadn't tried it before, they tried it. The experience was positive. And now of the total set of interviews, 43% of the people said if there is a telemedicine option, they would use telemedicine to engage their doctor, to engage their providers. So think about that on the other side. If you are a provider of medicine, you really need to think, how are you going to adopt this technology? Because consumer preference is going to be in the adoption of these things. Some other interesting facts of the study is, even though entertainment, for example, is an industry that has been hard hit, not everybody is going down. It is part of that industry that they're going up. Specifically, streaming and esports. Esports saw a 400% increase of adoption just in the month of April. So what that means, if you're in the entertainment industry, the future is probably going to be a more balanced combination of real live events with digital content, because the adoption of the digital form of entertainment is really taking off. A few things that I can cover, for example, on telecommuting. Obviously, not a surprise, a big race on telecommuting, almost a 500% increase of the people whose jobs could actually be performed from telecommuting. But here's the interesting thing of this study. Even when asked, the people, when they're allowed to return to their normal workplace, over 43% said they would prefer to retain the option to some days a week do telecommuting. So again, for those jobs that can be done on telecommuting, the trend is here to stay, is not a temporary trend. To conclude, one of the questions that we cover is, so what are the leading companies doing to adjust to these trends? And what I share with a lot of the Hispanics entrepreneurs is, whether you're a big company or you're a small company, there is a couple of things that are very important. One is adoption of technology, the digital technology that really is going to enable to power the business on those more digital consumer trends. But the second thing, and I think is very important, is technology alone is not going to solve the problem. It has to be technology with people that have to be trained, they have to understand these new capabilities, and they really need to have the skills, because the best combination, the best companies are those that use both technology and people in synchronicity to deliver a bigger value. So the stress and the importance of using this time to learn skills, educate themselves. And of course, we made the announcement that on www.ptech.org, we have free training, both in English and in Spanish, for anybody that want to improve their digital skills, came into context, because that's one of the things that everybody really can do. And I really want to figure out a way to get this to all Hispanics. If they have time, use the time to learn these skills. And we need to work with the ecosystems to make sure that all of those Hispanics that don't have internet, that don't have a computer, don't have a means to access it, that we establish this collaboration so we can give it to them, so they can gain these skills, so they can be even more relevant in the future. Again, sorry I couldn't be here in person, and I'm looking forward to seeing you next week. Thank you.
Thank you, Jesus, and thank you, everybody. See you next week.